Hi, and welcome everyone. Thank you for joining us today for our webinar. We have an excellent panel, and our webinar is going to be on dental guidance for dental hygienists to return to work in times of COVID-19. My name is Katie Conklin, and I'll be today's organizer, and it is my honor to introduce Dr. Bahar Aman today.
Good afternoon, everyone. I'm the moderator of the day today, and it's my honor to work with an amazing group of presenters and panelists to talk about dental guidance for hygienists as we return to work in these times. Next slide, please, Katie. Great. So today we are going to have California Dental Hygienists Association as well as California Dental Association working in collaboration with California Department of Public Health to this webinar and to bring some clarity on the guidance for hygienists in the times of COVID-19. Next slide, please. So just to give you just little housekeeping rules for today is that if you have any questions, please post them in the Q&A box. If there's any technical issues, you can put them in the chat box and we will get to them as soon as possible. We would mute all of you so that we can reduce the background noise, but we will get to all of the question and answers, and we'll try to answer as many as possible today. And if not, we will put an answer sheet and we will send that to all of you through email. So another housekeeping things is that when you go as far as your viewing options, if you go up there into view options, it gives you an option to fit to the window. I saw a comment on the chat that the slides are small. So if you go there, up there when it is green, next to that, Katie Conklin is sharing the screen, it says view option. So you can go there on the drop-down menu and then to do a fit to the window. Another thing for you to know is that the recording is going to be recorded, and also the slides are available and they're going to be posted on CDPH website for your records. Next slide, please. So again, we are here as a team and we are very happy that we are able to hold this webinar for all of you. Next one, please. So the objectives of the day today, we have an hour and we're going to review California Department of Public Health Dental Guidance Review overview. We are also going to have a focus on importance of aerosol reduction and infection control. And then we're hoping that through the panel, you'll be able to translate these guidelines from this professional agency into recommendations for you to return back to work in the dental settings. Next slide, please. All right, so our agenda today is we're going to have a couple of presentations, one from Dr. Jay Kumar, California State Dental Director, and then from Joanna Albo, Health Program Manager at Office of Oral Health. And then we're going to have a panel discussion with Darla Dale, Dr. Richard Nagy, and Dr. Jay Kumar. Thank you so much. Next slide. And with that, I would like to invite Dr. Jay Kumar, California State Dental Director, to give us an overview of California Dental Guidance Overview. Dr. Kumar.
Thank you, Bahar. Thank you for inviting me. We are very pleased to be part of this collaboration. Thank you, Ms. Darla Dale and Dr. Richard Nagy for joining us today. What I'll do, next slide, please. Next slide, please. So I would like to thank many contributors who have worked so hard to make this possible. Next slide, please. I'm going to cover a lot of topics today. I'll give you background on COVID pandemic in California, infection control practice, updated guidance, and some of the resources. So I'm going to be speaking really fast because we want to have a lot of time at the end to answer some of your questions. Next slide, please. Here's a slide about the California COVID-19 by the numbers. There's a website, a dashboard. You can go and get current information about the cases, deaths, hospitalization, ICU, discharges, all those facts and figures are available. And what you see is that the pandemic has changed over time. If you recall, when it started, the infection was spreading at the rate of about 1% to 2.5% to 3% in 5 days. And at that rate, it would have reached about 400 cases from one person. And now we think it is what we call the reproduction factor is less than 1. And that's the reason why we are able to allow practices to resume. With that rate and the flattening of the curve, it's possible to isolate cases, contact trace, and also handle surges in hospitalization. So what you see now is geographic variation. There are some areas with high rates and some areas with no to minimal community transmission. So you can access this dashboard and learn about community level data. Next slide, please. So I'm going to take a few minutes to talk about the authority here. Who has the final authority? It's a little bit confusing, especially during this time of COVID pandemic. And this is pertaining to infection control practice. And I want to start with the federal government. So we look for guidance from the Centers for Disease Control regarding infection control practices. So OSHA at the federal level is the agency that gives guidance regarding protecting patients and providers, not patients, protecting employees. And FDA is involved in certifying all these different types of tests and approving them, as well as equipment, especially N95. So you will see FDA approving some, disapproving, suspending. So that's part of because of this pandemic, they've given emergency approval, and sometimes they change these emergency approvals, and that's why there is some confusion about what is approved, what is not approved. The next level is state. So at the state level, infection control practice is in the regulations in both the state boards. And those regulations are linked to standards in Cal-OSHA. So Cal-OSHA is the agency that administers the occupational safety health regulations in California. So during this epidemic, so Cal-OSHA has very specific standards about bloodborne pathogen standards, as well as airborne standards, transmission-based precautions. So those are all in Cal-OSHA standards. And during this pandemic, if you recall, our state health officer issued the stay-home order. And so the California Department of Health offers guidance as to hospitals, outpatient clinics, nursing homes, as well as dentistry. And then at the local level, they are actually the enforcing authority. So they have the controlling authority. In other words, they can issue guidance that are more stringent than the state or the federal level. So you will see variation at the local level because those guidance they are tailored to the needs of the community, and they're all based on community conditions. So, and the role of professional organization is to implement these standards, regulations, recommendations, providing resources and tools. So the recommendations that you keep hearing, they're all coming from federal, state, and local agencies. And the professional organizations are providing help, assisting you in implementing that. Next slide, please. So what we have done here in California is we have the CDPH guidance document, and we have asked local health officers to issue local guidance only if there was a previous guidance and we want them to align with the state guidance. And because of the community conditions, some of the local health officers have more stringent guidance. And in those cases, we have asked them to communicate those local guidance to dental professionals. And And there are many communities where previously they didn't issue any specific guidelines, and we have asked them and urged them to reinforce CDPH guidance. Next, next slide, please. So we issued our guidance on May 7th, and May 19th, CDC issued updated guidance, basically to resume non-emergency dental care during COVID-19 pandemic. So our guidance is aligned with these the updated CDC guidance. So basically, we anticipated what these guidance was going to be and incorporate many of them. And in our guidance, there is a link to the CDC CDC guidance document. And what new information is included? So there are some very specific information that is included in the current version of the guidance document regarding facility and equipment, sterilization and disinfection, and use of test-based strategies. Primarily, they conclude that this is a droplet, this is transmitted through droplets, and the airborne transmission is highly unlikely. But we have to be concerned with the aerosolization of the droplets. That's why there are some added precautions we are undertaking in addition to droplet precautions. Next slide, please. So when we issued our guidance on May 7th, our main objective was to address emergencies and also potential emergencies, because many of these procedures were postponed or stopped in the middle of the treatment procedure. So we wanted them to be completed. And also we wanted to prevent emergencies, future emergencies, because many people have, they're predicting that there will be another wave in the fall, and it can be a combination of both COVID and influenza. So we don't want to be in a position where these emergencies show up in the middle of this double pandemic or epidemic. So that's the reason why we wanted to provide preventive services, and we specifically mentioned fluoride, sealants, and scaling. And also we emphasize non-aerosol generating dental procedures. And if aerosol generating procedures are necessary, we have some recommendations about how to manage those aerosols. Next slide, please. So in our guidance, there are some general considerations, and then there are very specific dental considerations. So in general, we discussed these geographic variations, and you have to pay particular attention to local orders. And then we urge everyone to have at least 2 weeks supply of PPEs. And there are recommendations about screening and testing, and also about visual signs in the office. Next slide. So this is the hierarchical approach to manage the risk in a dental setting. So the way it is laid out by NIOSH is the most effective way to manage the risk is by eliminating the risk. And this can be done by screening and ruling out COVID-19 infected persons. There is one big issue with screening for symptoms. There can be a high proportion of asymptomatic patients. So that is the reason why in some communities they would like to undertake tests, but there are some issues related to tests as well. But if the community transmission rates are low to minimal, we should be able to manage to screen out most of the COVID-19 patients. So the next level is engineering controls, like creating barriers, using evacuation systems, dental dam, other tools, and the way you set up instruments and not expose it to aerosols. evaluating airflow, air filtration devices, ultraviolet irradiation. All these are part of engineering controls to minimize the effect of aerosols when they are generated. And the next one is about administrative controls like hand hygiene, personal hygiene, limiting the number of patients who are inside the building, and then keeping 6-foot separation, and also providing masks to everyone who's in the office. And lastly, it's about PPE. So as you can see, the hierarchical approach, the most effective and the least effective one here. So respirators, masks, shield, eye protection, gloves, and protective clothing. So through all these different approaches, we are minimizing the risk of exposure in the dental setting. The next slide, please. So here are some very specific considerations regarding dental issues. So evaluate the necessity of care. As I said, we are encouraging potential emergency issues as well as preventive procedures because we don't know what's going to happen in the fall and in the winter. So you have to exercise clinical judgment on a case-by-case basis to select these cases, and also have patient scheduling and flow protocols in place. And finally, comply with Cal OSHA requirements. And there are very specific requirements. And one important thing is to develop a respiratory protection program. And there are 7 key elements to this one. And the California Dental Association has a very nice toolkit that can be used to adhere to these requirements. And of course, training is a key part of all this. Next slide, please. Okay, so this is my last slide, and this is how we want to eliminate the risk. So initially, when the COVID epidemic started, CDC recommends screening for only 3 symptoms, and then, of course, measuring temperature. So we are now using, about 10, 12 symptoms, including rash and diarrhea. Those are, they have not been added to the CDC list, but some of the hospitals are already using that in the checklist. And contact, if anybody has come in contact with a COVID patient or a suspected COVID patient, and those patients should not be scheduled for dental procedures until either the infection resolves or the diagnosis is confirmed and COVID-19 is ruled out. So this is right now the best way to screen patients and schedule them for dental appointments. So I'm going to stop here, go to the next slide, and ask my colleague, Ms. Joanna Albo, to provide information about interim recommendations for minimizing aerosols. We recognize that this is not the ideal because, and during this pandemic, we want to provide the best care that is possible, and we have some recommendations for achieving that. Thank you.
Great. Thank you so much, Dr. Kumar. And we would like to welcome Joanna Albo from Office of Oral Health, a health program manager. And Joanna, we look forward to hearing your presentation.
Okay, great. Thank you, Bahar and Dr. Kumar. So good afternoon, everybody. Thank you so much, and thank you for joining the webinar this afternoon. As you can see, we find ourselves in a new state of normal, and we're looking for how we can continue to provide care with the current restrictions that are happening right now. Because of the unique characteristics of the dental setting, we have to implement additional infection control considerations, not only to protect against bloodborne pathogens, but now transmission-based standards to protect against aerosols. Although we cannot eliminate aerosols, employing interim changes to reduce or minimize aerosols is key during the reopening process. the California Department of Public Health recommends avoiding aerosol producing procedures such as a rubber cup polishing and ultrasonic scalers. And I apologize, Katie, I forgot to ask you to advance the slide. Oh, thank you, there it is. Okay, avoiding aerosol producing procedures such as rubber cup polishing and ultrasonic scalers. Implement reduced aerosol procedures such as fluoride varnish, glass ionomer sealants, hand scaling, and toothbrushing. If during the initial appointment, the ultrasonic scaler is deemed necessary for complete calculus removal or scaling a root planing procedure, wait 10 to 14 days to schedule the appointment for a non-COVID symptom patient. If the patient presented for the initial appointment symptom-free and remains symptom-free for 10 to 14 days, this will greatly reduce exposure risk level. Also, use the high volume evacuator, which allows for removal of high volumes of air in a short time and reduces the amount of bioaerosols by as much as 90%. So scheduling a patient with COVID or COVID symptoms is not recommended. Next slide, please. Thanks, Katie. All right, so do the prophylaxis in this way to minimize aerosols. We perform a prophylaxis to remove hard and soft deposits on the teeth. In the interim, consider using a toothbrush and floss to remove plaque and extrinsic yellow stain in place of a rubber cup. Toothbrushing is also recommended as an alternate to rubber cup before sealant placement, and we'll talk about sealants recommendation here in just a moment. And then hand scale to remove calculus and remaining stain. So a historical reason for routine rubber cup prophylaxis at preventive visits was the belief that it was necessary before topical fluoride application. So over the years, there have been numerous reports showing that plaque and pellicle are not a barrier to fluoride uptake in enamel, and consequently, there is no evidence of a difference in caries rates or fluoride uptake in subjects who receive rubber cup prophy or a toothbrush prophy before fluoride treatment. The potential for abrasives causing tooth wear and the loss of the fluoride-rich enamel layer gained attention in the late 60s and 70s and has been cited as a consideration for decreasing the need for pumice prophylaxis. As a result of these findings, the selective polishing procedure and the toothbrush prophy procedure have gained popularity. The toothbrush prophy has gained acceptance in the professional and dental insurance industry as a way to remove plaque, provide oral hygiene education, and facilitate the clinical examination. The clinician should select the least aggressive technique that fulfills the goals of the procedure and minimizes the loss of enamel and reducing aerosols. There have been some discussions recently about toothbrushing causing aerosols. There are no studies showing toothbrushing is creating more aerosols than rubber cup. This concern may have come out when Head Start temporarily stopped their school site toothbrushing program, but the reason they did this was a concern for spitting and not toothbrushing. So they were concerned about the children's, so they sit around a table and practice the toothbrushing, and then they spit into a cup. And it was the spitting that they were concerned might cause additional aerosols. That was the temporary reason why they stopped that. Okay, next slide. Thank you. So this recommendation of prophylaxis using toothbrushing to remove plaque in place of a rubber cup is supported by the American Academy of Pediatric Dentistry. Next slide. So another recommendation to minimize aerosols is to use glass ionomer sealants. Resin sealants have a slightly higher retention to pits and fissures than glass ionomer sealants. However, resin-based sealants have been shown to lose almost all of their protective effect once retention is lost. In contrast to resin, even when the glass ionomer sealant appears clinically as partially or totally lost, small amounts of the material does remain. The glass ionomer material stays within the depths of the fissure since it bonds chemically to the tooth, and consequently the sealing effect continues. This remaining material provides a barrier to the bacteria and also promotes remineralization through the release of fluoride. So the advantages of the glass ionomer sealants is that they're hydrophilic in nature. This makes it compatible with the challenging environment of the mouth and excellent to use under the current circumstances. It sets rapidly, which can also reduce sensitivity to moisture. It releases fluoride, like we just said, which allows remineralization of enamel and provides an antimicrobial effect. It has the ability to release other ions, notably calcium and aluminum, and this has been studied. There's evidence to show that the ions also promote remineralization of the tooth. Next slide, please. So as a reminder, toothbrushing in place of rubber cup prophy prior to sealant placement has been shown to be effective. Direct evidence from 2 clinical trials shows no difference in complete sealant retention between surfaces cleaned mechanically with pumice and those cleaned with dry toothbrushing. Indirect evidence from 10 studies found that weighted summary retention by year after sealant placement in studies that used toothbrush prophylaxis was greater than or equivalent to values for studies that used handpiece prophylaxis. And that study came out of JADA, and there is a link there. Okay, next slide. Lastly, we decided to add some information regarding pre-rinsing, as we have been receiving questions about its effectiveness. The CDC has updated recommendations for using pre-procedural antimicrobial mouth rinses to reduce aerosol exposure. Studies show that their use for 60 seconds significantly reduces the level of oral microorganisms and the aerosols generated during routine dental procedures. So previous studies have shown that SARS-CoV and MERS-CoV were highly susceptible to povidone mouth rinse. Therefore, pre-procedural mouth rinse with 0.2% povidone iodine might reduce the load of coronaviruses in the saliva. Another alternative would be to use 0.5 to 1% hydrogen peroxide mouth rinse, as it has non-specific virucidal activity against coronaviruses. So that concludes this portion of the slide presentation, and I'll turn it back over to Bahar. Thank you all for your attention. Have a good afternoon.
Thank you so much, Joanna. Thank you for bringing some practical answers. I know there's going to be a lot of questions around all of this. And with that, I would like to bring our next panelist just to give an overview of what California Dental Hygienists Association have been doing, and give us a little bit of update on their hygienists coming back to work. So Darla Dale, welcome. And Darla is the president of California Dental Hygienists Association, and I would like to hear from you.
Thank you, Bahar. I wanted to first say thank you to everyone, especially Dr. Kumar, who answered my call and was able to put this together with UCSF to provide this information to the dental hygiene community. We've had a lot of calls into the California Dental Hygienists Association, as well as a lot of social media questions that have come up. And at the California Dental Hygienists Association, we've paid close attention to what's going on with the social media questions and concerns and have tried to address those. Currently, we've had multiple webinars and Zoom meetings to try to address concerns for the dental hygiene community. And recently, our public health department put together an extensive list of all the most current resources that are available to the dental hygienists as well as dental professionals in general. And that list is a pretty comprehensive list of links to CDC and OSHA and American Dental Association, California Dental Association, California Department of Public Health, etc. Within that list, we are also including a complete list of the California County Public Health Departments. That way, the dental hygienist who has questions regarding their own local protocols and procedures that are in place for dentistry can access that information right there on the sheet that we're distributing, and that's going to be coming out later today or tomorrow. And you can contact your local health department and find out what guidelines are in place for your local, because it does, as Dr. Kumar said, vary from county to county. So we're doing quite a bit at the California Dental Hygienists Association to try to educate and keep our dental hygienists informed so that we can alleviate some of the fears about returning to work. And I wanted to give a big shout out to the COVID-19 clinical care work group, which I was able to I was invited to by Dr. Kumar and Dr. Richard Nagy, president of CDA. And I've not only been very happy to be a part of it, but I've also learned a lot myself so that I can bring that information to back to CDHA. Thank you.
Fantastic. Thank you so much, Darla. And with that, I would like to ask Dr. Nagy, Dr. Richard Nagy, the president of California Dental Association, to give us an overview of where CDA is and some updates from CDA perspective.
Yeah, hi, thank you, Bahar. And I just wanted to say, I know you want to have time for questions, that we developed the clinical care work group to look at what does it look like going back into our office to make sure it's safe for our dental team as well as for our patients. The dental team is very important. That is why we had a wide group of people, and the collaboration we had between the Department of Public Health with Dr. Kumar, the dental hygiene community through Darla Dale, the dental assistant community through Sherry Becker, as well as many talented leaders in dentistry, both in private practice and education, created these documents that are based on CDC and CDPH guidance. And again, the collaboration was spectacular. I think we're probably the only state to do so. So with that, I just wanted to say thank you for being at this webinar, and we're here to answer your questions. Thank you.
Fantastic. Thank you so much. So we're going to invite all of our speakers to the panel, and we're going to bring the questions to them. So Dr. Kumar and Darla and Joanna, please join us. Fantastic. Oh, I see. Actually, Joanna is not joining us as a panelist, as Dr. Kumar is presenting California Department of Public Health. So I want to start with one question, and then I will start with the ones that are coming from the Q&A box, and some of them that have been submitted to us prior to the webinar. So we heard all of these guidelines, and we heard about the recommendations. In a clinical setting, how would you say that one would prioritize what procedures to do and what not to do? Like we talked about the scaling, we talked about the sealants, we talked about reducing the aerosol generating procedures, but you know, there are different situations that happen, and I would like to hear from you that how would folks prioritize the procedures?
Well, for me, looking at those cases that have been delayed, that are urgent, that need to be addressed and treated, and so that they don't develop into an emergency. But it also depends on how much PPE you have, what engineering and administrative controls you have in your practice to be prepared to see some of those patients who have been delayed, who may need to using a high-speed handpiece, which means you're now developing an aerosol. It would be best to do all procedures that do not need an aerosol production if you can, but it's going to be based on the clinician's professional opinion on which patients they need to treat first. But again, you need to look at how your whole infection control practice is for your office before you start making those decisions. Darla, how about from your perspective?
I'm definitely in agreement with that. I think it really depends on the individual patient and what their needs are. Most of us have been in practices for many years and know our patients well. We know their patterns, their lack of oral hygiene, or how good they are at their oral hygiene. And so I think what we need to look at that our patient pool and prioritize procedures as to the risk of the patient, and really look at that. And we do know some of our patients also have many comorbidities and are at high risk. So we should also look at those patients to help them as soon as we can too, so that we can keep them out of trouble with their medical conditions.
Great, thank you so much.
So, Bahar,
yes,
I want to say our general approach. You know, I know everyone is looking for a definitive answer, and because this virus is very new, there are a lot of things happening, and we don't have vaccine, we don't have treatment. We always, you know, when we make statements, we always use some caveats because of the uncertainty associated with the virus. If I knew everything about the transmission, the safety I would be able to give you very specific recommendations. So as a clinician, I urge you to use your professional judgment. So this is the time where you should, read up all about COVID, there are a lot of resources available, and tailor your treatment plan according to all these different factors.
Mm-hmm. Great, thank you. Thank you. Yes.
I guess follow up real quick. A lot of those resources are at cda.org. The Clinical Care Work Group created a wonderful back to practice guidances with many checklists and forms and the information Dr. Kumar and Darla are talking about. You can find it all there if you wanted to find it in one place.
Great, cda.org. So a lot of those resources are over there. Great. Just a follow-up, one of our attendees had a question about, we have contacted the state, county, and local counties for resources around masks. And I know there's a lot of questions around masks, but it seems like there's a little bit of confusion about who would provide masks, N95 masks, to the local dentist and hygienist. And do you all have an update on that? Do you know where people can go about that?
Yes,
Go ahead.
I have one. The tdsc.com through CDA has, based on our advocacy with the state, we have received PPE from the state to be given out to dental offices. So starting the end of this week, I believe on May 28th, dentists can go to this tdsc.com and request a box of PPE. No charge, just shipping and handling, that's all. And the box will contain over 100 surgical masks, as well as a small amount of N95, KN95 masks, as well as face shields and gowns. And then TDSC is also starting to be able to procure additional PPE that people can buy at the tdsc.com website.
tdsc.com.
Correct.
Fantastic, great. So since we're talking about masks, and thank you so much for CDA for all of the advocacy that you have done, Dr. Nagy, and your team. It's really appreciated.
Thank you.
Thank you. So talking about masks, there's a lot of questions around getting clarity around N95 mask. How often can people use that? What if an employer asks them to use it for 2 weeks in a row? What are the guidelines around disinfecting them? So do any of you know, have any specifics around that, or any place that somebody can go and just get exactly what they need to do around that?
So if you go to CDC website and type in recycling N95 mask, it will take you to a web page where there is a lot of information about reuse of N95. So CDC is the best place for right now. And I'm sure ADHA and CDA, CDHA have, under frequently asked questions, some of those responses as well.
Mm-hmm. Great. So all of the questions around N95, and I know afterwards we're going to compile these questions and kind of give more answers to them, but all of the questions around N95 can be addressed through CDC website, basically, right?
Mm-hmm.
Yeah.
Yes.
Great. Here is, and I know there are some other questions around how can they obtain fit test in California? Do you know where can people go to make sure that we know that its efficacy is increased by being fitted right? So do you know where people can go to get that?
Yeah,
so there
there's,
is, yeah.
Jay, you take it.
Yeah. Yeah, we have done some, research, and our occupational disease branch works with a group of people, and we have we can provide a link. Local health departments have that information. So we will be able to share that link with CDHA.
Great.
And
Maggie,
Yes,
you wanted to add something?
yeah, because at the CDA website, cda.org, under the resources for back to practice, one of them is the N95 mask and fit testing. And if you just scroll down to the third one, It'll give you the website of looking for industrial hygienists, third-party people who can do fit testing in conjunction with public health as well as local hospitals. The Santa Barbara Ventura County Dental Society, which I'm a part of, they're actually looking to bring a fit tester to the Dental Society for offices to bring their team to be fit tested there. That's another opportunity you can do locally in your community.
Also,
Great.
Dr. Kumar, California Department of Public Health and Dr. Kumar gave direction to the local public health departments to be able to offer the fit testing. And I know that our local health department is planning to do that. We did meet with our oral health director here through Humboldt County Public Health. So each public health department may be a resource also to do that fit testing.
Fantastic. Thank you so much, Darla. Yes. So we talked about N95 masks, and there are times that there's going to be not enough N95 masks, and there are options of like based on the procedures to use other options. Would any of you elaborate on that? That what are the options and how people can practice safely without N95 masks, and what procedures are safe to do without that?
So during this time of shortage of N95, an option is to use surgical mask with full face shield. So that is an option.
Mm-hmm. Yes. Dr. Nagy.
Yeah, I was just going to say under the CDA website, they're under PPE. We actually, our clinical care work group came up with a chart. On the left side is on what you're doing, whether it's administrative, lab, no fluid, low fluid, or moderate severe fluid, and then what PPE you need on top, and it helps guide you into what you need. And the only areas where you really need the N95 masks, and you really need to have those, is on moderate to heavy, severe aerosol production. Low fluids and up, you can use a level 1 through 3 mask, and a lot of the cases, minus administrative, wearing a face shield on top or goggles would be very advisable. But there's a lot of resources and information in those resources on our website.
Yes, great.
I
That's
agree
a
with
very
Dr.
good
Nagy.
point.
Go ahead, Dr. Kumar.
That's a very good point, Dr. Nagy. So the CDC recommendation is if you're generating, droplets contain, blood is splattering or body fluids, like saliva splattering. So to protect against that, surgical mask will work with a face shield. So you need N95 when you are generating a lot of aerosols, especially when you're not controlling using high evacuation systems.
Mm-hmm. Great.
That's what I was
Darla,
going to
you're
add.
gonna
Is I
say
think that there's a lot of misunderstanding about the N95,
Yes.
which is what I think Dr. Kumar and Dr. Nagy both cleared up. Is that I think most hygienists think from what they're hearing rather than what they're reading.
Mm-hmm.
If I go into my office and there's no N95, I shouldn't be working, and that's not necessarily true. That's not what the guidelines say. So be very careful about listening to others versus educating yourself on what the guidelines are. There's fantastic resources available. I can't emphasize enough how well CDA put together their back to work toolkit and educational program that you can actually bring back to your office and get CE units to take. We put a lot of stuff together in the work group that was really good information, and there are alternatives to N95, and I think people are just thinking that hygienists in particular, that if there's no N95 available, they shouldn't be working, and that's not necessarily the truth. So I just wanted to clarify that.
Thank you so much for that. Thank you for that. There are some questions coming in around, just since, or has been submitted before as well, since we talked about the, employee, employer, and all of that, about navigating the relationship and navigating these conversations with the dentist, right? Like dentist might have a certain guidelines around PPE, let's say, wear the N95 mask for 2 weeks, for example, right? And the hygienist might not think that that's appropriate. So how would you say that hygienists should navigate scenarios like that and use their judgments around that? Darla, maybe I'll start with you.
Well, again, I think that read. You need to be informed on your own. So you need to go and educate yourself on what the guidelines are. I wouldn't go to my employer and say, well, this is what I've been told, this is what I've heard, I'd bring the facts with you and say, well, this is what the CDC states, this is what OSHA states, and have that information to share. You know, these dentists, unfortunately, you know, their businesses have been at risk for the last 2 months of not even opening again. They're concerned, they have many, many concerns other than protecting their employees. And so you need to help and assist and be part of the team, just like everyone else, and educate not only yourself, but also educate your dentist that you work for, your employer that you work for, because maybe they don't have that information, you know, in front of them. They may have been busy trying to figure out how they're going to meet payroll, you know, so be compassionate and understanding that they are business owners and that they're having issues and stress also, and try to help them out just like you would help yourself out, and maybe give them a little education in a friendly way. And I think that it's best for the entire team, for everyone to be on the same page. You could even offer to educate the assistants, the office manager in particular, who is probably ordering some of that PPE for you, but make sure everybody in the office is on the same page, and don't leave it up to them. Make sure you have the knowledge that you yourself can bring forward as a professional. You are professionals and you should have this information for sure.
Great, thank you so much. Anybody wants to add to that?
Yeah, I'll follow up. I guess I first have to say what a joy it has been working with Darla on this work group. She has brought an enormous amount of perspective and respect and kindness. Just look at her, and it's been really helpful hearing from the dental hygiene perspective on what we need to do in the office for safety. The CDA back to practice training that Darla alluded to, it's about 4.5 or more hours with some video, as well as multiple check sheets that the whole office can do together. And then that's an opportunity to have these discussions. It's all about the relationship that you have with your team. And if you have a good one to start with, you're going to have a great one through this. If you don't have a good one before COVID-19, I think it's just going to exacerbate the underlying issues that's been a problem for a long time. Doing this training as a group, as the whole office together, it allows all those opportunities for conversations on what is acceptable, what is the plan. And then it also has an opportunity for people to state what they need in order to feel comfortable. And some of those needs may be far-fetched and not really the minimum standard of safety, but it may be something the office may want to include based on how their layout is.
Great, thank you so much. Great. So there's some questions around ultrasonic scalers. You know, if we do brush proofing, do patients really feel that they got a polish? And I know Joanna just brought some research around that is actually effective and all of that. But so when it comes to ultrasonic scaler, do you all say not use it at all? Or are there, and I know you are a periodontist, Dr. Nagy, are there cases that you know, that's the only option that one has? And then if so, what to do? So what are the lines around ultrasonic scaler, toothbrush prophy, and all of that?
So I think we've all talked. I mean, we're all friends, and we were all three of us on the work group together, and we all agree. Minimize the aerosol right now. We're still learning about this virus. It's still in our communities. So let's minimize aerosol. As a periodontist, one of the major things you do in a periodontal maintenance appointment, number one, remember when you were in school, exam. The examination is the most important thing for continuation of periodontal disease. Is there caries? Is there a cancer? Is there anything else that you need to address? And that's the most important point, is following up with, you know, obviously hygiene instruction, and then hand scale. Never say never, never say always. There'll be some cases that have so much calculus, you need to do the ultrasonic. And if so, you need to have another assistant there, PPE with high evacuation suction, suctioning it. But that's more of the one way out there that you would hardly do. And so, you know, to me, I think you can do it without.
But it also comes down to, it also comes down to what I said about the relationship with your dental practice and your dentist and your dental team. It also comes down to your relationship with your patient. I don't think a patient that realizes you're working in their best interest and the next patient behind them and the next patient behind them is going to object to the fact that you are not at this time wanting to use an ultrasonic scaler. Your patients would like to have as much information given to them regarding this virus, just like we want. And if you explain to your patient, I'm not choosing to polish, and this is my reasons why. I'm not choosing to use an ultrasonic scaler, and these are my reasons why. I doubt seriously you are going to have a patient that says, I don't care, I want you to use that ultrasonic scaler, I don't care about the patient behind me, and I don't care about you. I seriously don't think that's going to happen. I think a patient would appreciate you so much more knowing that you're putting these safety precautions in place for not only your health, but their health too.
Well said.
Thank you so much. That sounds great. Great, thank you. So there are some questions coming in around evidence around the rinse, the pre-rinse, and other. I know Joanna mentioned a couple of them, but is there evidence around hydrogen peroxide, the percentage of it? Is there evidence on using chlorhexidine, other kind of rinses? And is this actually what CDC recommends as well? Or is it what we think that common sense, it kind of makes sense?
Actually, this is a question that has come up. So in all these cases, we look for clinical trials where they have used it in patients, okay, with COVID. And as you know, it's very difficult to do those kinds of clinical trials. So in the absence of that, they've used, CDC has used some past experience, and I would say this is like a common sense approach. Mm-hmm. And they do recommend pre-procedural rinse. They ask you to consider pre-procedural rinse because it works on bacteria and some viruses. So it's not harmful and it's not that expensive. That's the reason why we agree with CDC recommendation.
Got it. Thank you. So there's some other questions. I'm going fast through the questions to kind of like be able to answer as many as we can. Hope you guys don't mind. I'm just moving fast and fast. So there are some questions around the testing and testing of the patients. I mean, there are some recommendations around who do you test and who not to test. And are there any updates from the new CDC guidelines that you want to share to bring some clarity around who needs to be tested before being seen by the hygienist or dentist?
Okay. So there are a lot of questions about testing, the type of testing. So there are, testing for the viral particles. There are testing for proteins, and then there are testing for antibodies. So the hospitals, before surgery, they use PCR testing 48 hours before scheduling for surgery. And then they ask patients to self-quarantine. Okay, so that is, it's very difficult to do all those things in dental settings. Right. So we're waiting to hear about something that is feasible in a dental setting like salivary-based tests. But until that time, we are not recommending testing on a routine basis, partly because it's not feasible, partly because it's not available. And also there are some questions about, some of the other types of tests, the reliability of some of the other types of tests. So at this time, we recommend that testing be done on, this is the CDPH policy in general about, those with symptoms and healthcare workers, people undergoing surgery, and high-risk population groups.
Great, thank you. Thank you for that, great. So there are some questions around the whole ventilation systems. And I know CDC in their new guidelines, they brought up some new recommendations around engineering systems and all of that. Can you, I know it's a big topic by itself, but which HVE systems to use, and what is your opinion around the standalone high velocity air filtrations or sanitations, kind of like a funnel type systems that are placed near the patient's mouth? I know I have seen a lot of pictures on that in my dental public health listservs. Different dental companies are coming up with different kind of filtration systems. So what are some thoughts around those? Dr. Nagy, do you have any?
I actually would rather hear from Dr. Kumar first because he's sort of our expert on CDC and public health.
Yes.
And that's where the directives are coming from, and the CDA and CDHA are interpreting them and giving resources and guidances to our members to implement. But he's the main attraction right now, as far as I see.
Yes. So Dr. Kumar, what are your thoughts?
So CDC says consider a filtration system, a HEPA air filtration for offices. But when it comes to HVAC, it's one has to study the air ventilation in an office, because the office, size and setting, all those things vary a lot. CDC recommendation is to consult a professional before making a lot of changes in the office about HVAC system.
Mm-hmm. And I know you and I were having a conversation, and those professionals sometimes are called
industrial hygienists.
Industrial hygienists, not dental hygienists. I thought they're like a subspecialty of dental hygienists. No, industrial hygienists, yes.
What you really need to look for is the turnover of fresh air in a room. And so depending on how your office location, how many windows that you have in an operatory that can bring fresh air in. For example, I have windows in every single operatory, which allows fresh air to come in. But a colleague in San Francisco says she has a front door and a back door and no windows anywhere. She needs to update and improve her air circulation through whether changing filtration in the HVAC system, and recommended going to like what's called a MERV 13 level filter. But that's what you'll get from the professional. They need to look at the HVAC professional and look at your system to see if there's anything they can do to help with filtration of small particles, because the virus is about 0.1 microns, and a lot of filtration stuff and masks are only to 0.3. So you need to take that into consideration.
Great, thank you so much. Great. So there are some couple of questions that people are asking. Does CDA, does CDHA recommend what CDC is recommending? My answer to that is that yes, but I don't know. I should ask.
I could just say that working on this clinical care work group with Darla and Jay and everyone else who was on it, we were doing evidence-based. We just read and we read and we read, spent over 100 hours together, and it seemed like what we came up with, CDC then changed their guidelines on the 19th. It was pretty darn close. What'd you say, Dr. Kumar? So I was like, were they like in the room with us the whole time? So yes, it's consistent.
It's consistent. Like the whole recommendations around waiting 15 minutes before you start wiping out, right? There's some questions around that or other things, right? Okay.
Well, I think the 15-minute wait is if you're doing an aerosol producing procedure, definitely you want to wait the 15 minutes. But if you're doing an exam or a post-op or something quick, no, you're not having aerosol production. Again, as Darla so acutely and wonderfully stated, use your professional judgment throughout the entire day on who you treat, how you treat, where you treat, and what are your office protocols. There's guidances, but it's your professional opinion how you're going to implement.
Mm-hmm.
Thank you, Darla.
I agree with you 100%.
That's great. So we have a few more minutes, and there's some questions that haven't been answered. I just want to assure the audience that we're going to get to them and send the answers to you. But in the meanwhile, I just wanted to see if there's any unanswered, anything that you want to emphasize, any of the panelists around how, just a word of wisdom to the hygienist.
Yeah, one thing I want to say is, you have to keep updating your information constantly. Every day, new information comes out. So the best way is to look at, some of these resourceful websites and keep updated about the information.
Yes, great. Thank you so much.
And I
Yes.
think that CDHA and CDA both are updating as soon as something new is released. Something that comes out from CDPH, anything new that comes out, we're pretty good about getting it out there on as much social media as we can. So we're doing as much as we can as far as keeping people informed. We would like people, of course, to take the initiative to look it up themselves on a regular basis, but we do put these blasts out there every couple of days on what the latest news is, and we've been really working hard at that.
That's
I'm
right.
very proud of my CDHA team for doing that, and CDA has been doing a great job. And I recommend people go to the CDA website because the clinical care work group, the information that there is, I can't say enough good things about it. It's very detailed and very thorough.
Great, thank you. And just to clarify before we hear from you, Dr. Nagy, for last words, is that if a county basically has guidelines that are more strict than what California recommends, then the dentists and hygienists are to follow that, right? The county guidelines.
Correct.
Great.
Yeah.
Great, yes. And Dr. Nagy, we want to hear any word of wisdom, any suggestions you
Yeah,
have?
just a couple things.
Yes.
I saw on the chat some questions. So to go to tdsc.com for the PPE information, those free boxes won't be available till Friday, if that's the 28th. I don't know what today is anymore, but it's May 28th is when they're going to be released, and other PPE is already at the website. You need to go to there, not CDA. And if you want that back to practice training, it's at cda.org, back to practice. You'll see it says training. It has a video in there, and it has 4 other areas where it's infection control for patients, infection control for the office, the webinar information. It's all on the website. And lastly, I just want to say, we are a team. All of us are the team, the dentist, the hygienist, the assistant, the front office, and the patient. We need to be together. We need to have conversations together. And I think this is an opportunity that's going to make a lot of offices or break a lot of offices, because you really need to have a conversation, and you need to have mutual respect and trust. And this is an opportunity to regain it, in my opinion. This has been wonderful. Thank you.
Thank you so much,
I
everyone.
also want to add the California Department of Public Health to that. I think that
Yes.
they've really stood up and really joined forces with us. And I think it's been great to have Dr. Kumar at our disposal on a regular basis, because we look to him for a lot of information. So thank you so much, Dr. Kumar, for being available to us.
That's great. Thank you,
Yeah.
all of you, for your leadership, for the collaboration. In these times, we really need that as a community of practice. So really appreciate that. And with that, and I'm hearing a lot of people are appreciating you sharing really your candid perspective on these matters. So with that, I would like to thank you again, everybody. We are going to share the recording and a slide on CDHA website. And we're going to get the answers to the questions that were not answered today and distribute that among you. So have a great rest of your day. Stay safe and healthy. Thank you so much.
Thank you.
All right.
Bye-bye,
Thank you.
everybody.
Thank you. Bye-bye.
Thanks, everyone.